Hello, my name is Sonia. I'm a student nurse practitioner with United States University, and I'm recording this examination. It's going to be your head, your eyes, ears, nose, throat check exam,
Okay,
and I wanted your consent to tape it.
I give consent.
Okay, can you tell me your name?
Charles Thomas,
Okay, Charles, your date of birth?
October 9th, 1986,
Okay, can you tell me where we are right now?
Atlanta, Georgia.
Okay, and who the first president is?
George Washington,
And the current president?
Donald Trump.
Okay, if you were walking down the street and you saw a house on fire, what would you do?
Call 911.
Okay, great. So your speech is nice and clear, and you appear to be well dressed, well nourished. You feeling okay?
Yeah,
Okay, great. So I'm going to start the exam by assessing your hair, your head. I'm just going to be looking at the texture of your hair. I'm going to be palpating your scalp. I'm looking for any abnormalities, any depressions. Okay, and everything feels good for your head. Okay, so that's for your head, and then so head, and then we're going to do a eye exam. Okay, so let me get my scope, and then I also want to do for your eye exam. This is for your visual acuity,
okay.
and read the lowest line you can see.
LTFPH,
Okay, cover one eye,
LTFPH,
cover the other eye,
LTFPH,
and both eyes.
LTFPH.
Okay, so that's your visual acuity. And then I'm just looking at your eyes. I see no exophthalmos, no ptosis. And then I'm looking at your eyelids. Okay, just gonna look under here. Conjuncta is nice and pink. Your sclera is white. Your eyelashes. I'm looking at your lacrimal glands right up here. No drainage, no problems. Did you have any pain with that?
No,
Okay, good. And so I'm also going to just check your eyes. So I want you to just look at the light. And I'm looking. Okay, sorry. So I'm looking to see your cornea, see if they're equal, your iris. Okay, and then I'm going to be looking at your pupils, and I'm going to look to see if I'm dimming the light, and I'm looking to see that they are equal and reactive. I'm looking at that eye, I'm looking at this one, that's direct, and then I'm looking to look at this eye, and I'm looking for that eye to constrict as well. And I'm looking at this eye to see it constrict as well. So that is direct and consensual. So your pupils are equal and reactive. Okay, and then um, I also want to look at your optic nerve and your optic disc. And I'm going to put my light up. Look straight ahead. I'm looking for the red reflex. And then once I find that, I'm going to look directly. And I'm looking for your optic nerve, your optic disc. I can see the vessels are nice and healthy. Okay. I'm going to do your other eye. Again, I'm looking for the red reflex. And I'm going to come in and I'm looking for your optic disc, optic nerve, and your vessels. and everything looks good. Okay. All right. And then I'm checking for your peripheral vision, and that is, I want you to follow my finger. Okay. So I'm going to go. I'm going to put straight through here. Okay. Okay. So that I'm testing for convergence. And I'm also looking to see if there's any involuntary movement in your eyes, which I didn't see. So there's no nystagmus. Okay.
Okay.
And then just looking at your eyebrows, the symmetry of your face. Okay. Then I'm going to palpate your frontal sinuses right here. Any pain or discomfort?
No.
Your maxillary sinuses right here?
No.
No problems? Okay, great. And so I'm checking your extraocular motor, and that's the cranial nerves 3, which is ocular motor, 4, trochlear, and 5, which is your abducent. And that was the nerves I was checking with the 6 gazes of field. I'm making sure that you don't have, that your muscles are doing what they're supposed to do, and that there was no involuntary movements with that. Okay? And we're going to be doing the visual fields by confrontation at the end, because we have to switch seats so we can be eye level. Okay? All right, so the next thing I want to get together is my, I'm going to switch my ophthalmoscope to this one. And I'm going to be checking your nose. Okay. So I'm just going to be, I'm looking at it. Do you have any pain or tenderness?
No.
No? Okay. I'm going to look in one nostril. I'm looking at the mucosa, which is nice and pink. Okay, on that side. That side. Any pain or any discomfort?
No.
Okay, so I'd like you to close one side and blow out. Okay, the other. I'm looking for your airflow. And then also, I'd like to check your smell too. So I'd like you to hold one side. I'm going to put a scent here. Can you tell me what this is?
Lavender.
Okay, great. And the other one? Can you tell me what this is?
Vanilla.
Okay, perfect. So I'm checking your airflow, your smell, and then I'm just going to just look at my paper just to make sure I have everything. Okay, and then okay, so the accommodation means that your eyes have the ability to see things close, like you could look there and that'll come into focus, and then you can see something right here and that'll come into focus, and that is referred to as accommodation with your visual. Okay, and then for your nose, as I said, no tenderness, no obstruction.
No.
Okay, good airflow and smell.
No.
Okay, and now I'm looking at your mouth, I'm looking at your lips. They're nice and moist. And I want to look at your open. I'm going to look at your teeth. Looking at the gingiva. Open up wider. I'm looking at your buccal, and that's nice and moist as well. Open up.
Uh,
I'm looking at the soft palate, rising symmetrically, looking at your tongue line, midline. I'm going to have you look one more. I want to look one more time. I'm looking posteriorly at your um, uvula, making sure that's midline. Okay. And then I want you to stick your tongue out again, and then to each side. Okay, great. So that's your mouth. And then I want to do your neck. And I'm looking, which your neck looks nice. I don't see any abnormalities. So I want you, I'm looking at your range of motion, and I like you to look down, up, to that side, to that side. Put your head, your ear to your shoulder. Okay, perfect. All right, so, all right, I'm just gonna look again. I just want to see where I'm at. I don't want to forget something. Okay, so, okay. So the next thing we're going to do is your ear, okay? And I'm going to be looking. You have any pain or anything here?
no.
I'm looking for any drainage. Does this feel okay? Any problems with any of that?
No.
Okay, and so I'm going to be looking inside. And I'm going to be looking for your tympanic membrane. I'll have you reveal it this way. Sorry. Okay, so it's pearly white. I'm looking for the cone of light at 5 o'clock. Right, and I'm going to do that on the other side. I'm feeling for any kind of nodules, cysts, anything abnormal. And I'm going to look in this here. Any pain or discomfort with that?
No.
Okay, perfect. Okay, so did your head, your ears, your nose, your mouth. I had you turn your neck. And now I'd like to check your lymph nodes. Okay. And these are your preauricle, postauricle, occipital, submandible, submental, anterior cervical, posterior cervical. Any tenderness?
No.
No. Okay, good. All right. Okay. And I'm going to be doing testing your cranial nerve 8, and that's for your hearing. And I'm going to do the whisper test. So I want you to hold one. And I'm going to whisper a 2-syllable word, and you tell me what you hear.
Apple.
Okay, your other ear.
Baseball.
Great. Okay. And so now I'm going to do another test. It's the Weber, and that's testing for lateralization. And I'm going to hit my tuning fork, put that on your forehead, and I want you to tell me where you hear or feel it on one side or the other. Okay. You ready?
Both sides.
Both sides. Okay, good. All right, and now I'm going to do the Rhine test, and that's for air and bone conduction. So I'm going to strike it, I'm going to put it on your mastoid bone, and then I want you to tell me if you hear it, and then when you stop hearing it. And then after that, I'm going to move it to your ear, and I want you to let me know if you still hear anything. And I'm going to do that on both sides, okay?
Okay.
Mhm.
Stop.
Okay. You still hear me?
Yeah.
Okay. All right, I'm moving the other side.
Yeah. Stop.
Still hear me?
Yeah.
Okay, great. So that's your hearing, and I just want to look at my list again to make sure that I'm checking everything. Let's see. Okay. All right. Now I'm just checking for your trachea, looking for it to be midline or mobile. Okay. And then I'm going to, I wanted to check your thyroid. And so I'm going to be looking for the landmarks. I'm going to, right where your sort of Adam's apple is, which is the, I'm just going to feel right first. You can lean a little forward. Okay. So I'm going to look for the cartilage. Then I'm looking for the second tracheal. And then I'm going to put my fingers out a little bit. And I'm going to ask you to swallow. Okay. Okay, good. Swallow again. Okay, good. And then I'm also going to check it from the back. Okay.
Okay.
It does feel. Okay. Let's see. I'm looking for my landmark. It's like where your Adam's apple is. Your two tracheal. And then I'm just going to move out a little bit. And I'm going to feel for that. I don't feel any, do you feel any tenderness or any discomfort?
No.
Okay, so I don't feel any enlargement, anything abnormal. Okay, so now I'm going to have you switch seats so we can do the peripheral vision so that we can both be, in the right. So we can be eye to eye. Okay, so our knees are basically touching. Okay, and so what we're going to do is you're going to cover one eye, I'm going to cover one eye. And I want you to look at my eye that's not covered. And I'm going to be, this is for your peripheral vision. So I'm looking at your eye and I'm like dividing into 4 places. And I'm going to put a number up in each quadrant. And I need you to tell me that when you can see it. So I'm going to do one eye, then the other eye, and then both eyes. Okay, so this is my right hand. I'm going to cover my right eye. So you cover yours. Okay, and so I'm going to be putting fingers up 1, 2. Okay, and you can tell me I'm going to be doing the different quadrants. You can tell me if you see that.
1, 2, 1, 1.
Okay, other eye. Okay, I'm going to do your quadrants.
1, 1, 2, 1.
Okay, good. And now both eyes. Okay. Tell me if you can see.
1, 1, 2, 2.
Okay, good. All right, so that's checking your peripheral vision, so that's good. Okay, so that was your head, ear, and nose, head, eyes, nose, mouth, throat. Okay,
Okay.
and so we checked pretty much everything. So your vision is good. Your everything seems healthy. Your smell. You have any questions?
No, thank
Okay.
you.
All right, so I'm going to be doing your report and
Okay.
sending it to your doctor, but everything seems great.
Okay, thank you.
Okay, thank you. Okay.